We're going to have a health corridor update, and we have Ben from TO Engineers. It's going to enlighten us.
Ben, who figured he'd be out of here by 6:22.
I thought I was first on the agenda, right? Mayor and Council, thank you for your time. As the Mayor said, I'm Ben White with TO Engineers here in town representing our consultant team on the health corridor. Go through a lot of this relatively quickly, but if you do have any questions or anything, please don't hesitate to let me know. And somehow I'm not getting to full screen here. There we go. So first of all, you all know the health corridor, but as a quick reminder, where we're at in the process and why I'm here tonight, we finished community engagement and survey summary, or at least we're substantially through that process. It will, of course, be ongoing. I wanted to update you on everything that's happening there. And, of course, the design charrette was last week as well. So first of all, the study area for everybody's reference, I think you all know it, so I won't slow down to review it much other than to say it hasn't changed. Community engagement, we did a lot of work on community engagement over the last month, and I wanted to bring you up to speed on that. I won't go through them in detail, but here's 10 individual touches. Some of them were multiple times, but anyway, there were 10 individual events, if you will, plus all the coverage that the newspaper provided. And we also finished our survey, and this is a summary of the key results from the online survey. Again, I won't go through them all, but I will point out the top 5 in blue there are all related to transportation and mobility. You'll be pleased to hear that the availability of parking is number 3.
Free parking?
He doesn't say that.
Up to you. To back up a few steps, a month ago, we did the visioning. That's when I was here last. That was June 13th and 14th. We took all of those comments, used those as a lead-in to the design charrette. During the design charrette, a couple of us were also out doing some door-to-door work and some pop-up meetings. We did one at Kootenai Health, just to try and get people to do the survey and to know what's going on and to come and participate. And come they did. So we got going on the design charrette last Monday night. We had, I think, 20-some people the first day, and by the end of it, I think we had 35 that were attending. It actually went up as it went along, which was great. The way it was organized is during the day, the design team would come up with their ideas and their concepts, and then in the evenings, there would be a public presentation. We would gather all the public input. People would put a green dot on what they liked and a red dot on what they wouldn't like, and that would all be incorporated the next day. So the first day we had 4 different concepts. We did some of these, you did see in your council packet just because the file size was getting way too large. So the first day, 4 concepts were pulled together and put up for public comment. That was all gathered. Tuesday, the designers took that and came back with 2 concepts with all the best ideas, if you will. Again, that went through the public comment loop on Tuesday night. And then I'll get to showing you the grand finale here in a second, but Wednesday night we came forward with the final draft plan for everybody's consideration. I'm going to walk you through a few of the main key ideas and concepts that we generated as part of that master plan, so you can help understand it once you do see it. This slide is just simply highlighting all the existing street networks in gray. That was obviously part of our immediate central focus. The other thing we heard loud and clear was neighborhood stability and preserving the existing residential areas out there, which are highlighted here. That certainly is a key goal that's being incorporated into the current planning efforts. The next one was looking at doing some big moves with transportation connectivity. It's lacking. There were 3 major ideas that came out of it. The first isn't a new idea, but let's get another north-south connection and a bridge over the freeway, just to let people have another way in and out instead of being congested on Ironwood at Northwest, on Ironwood at 95, and then again at Lakewood Northwest. When you got, frankly, a job center as big as the hospital, plus all the patrons coming and going, That's not very many places to put them and funnel them all through.
Ben, I have a question.
Yes, Dan?
Is that exit, the one in purple or pink, whatever color
Oh,
that is?
yeah, thank you for slowing me down and backing me up a second. I skipped the other big idea, and that was, and probably one of the bigger ones actually, was working with ITD and local transportation agencies to see if we can get right in, right out turns off of 95
Okay,
between.
so it's just right in, right out.
What's that?
That's just right in, right out. That's not
Correct.
an intersection.
Correct. It would just be right in, right out. There are some congestion, there's going to be some concerns with these, so we're engaging the traffic people to talk about them. But one of the key things that came out was, let's try and keep the traffic from getting here to Ironwood and congesting that intersection further. And we could do that by giving the traffic the opportunity to come in and just free flow back in. And it's the same with the east side of the freeway. There's really no access into this back upper area here, much so to give them a right turn in to come in there. That would have to be well thought out and done carefully to make sure that it helps the problem instead of making it worse. And thank you for clarifying that. I had the three big moves and I skipped the one.
Wanted to make sure that it was allowed, because I thought the limits on an ingress or egress from a freeway had to be a certain distance.
Yeah, they have standards for that. It all is going to tie into the interchange study that ITD just finished right here, and how it works. They're going to be the approving jurisdiction.
All right.
And we're just starting those conversations to see which direction we could go with it, Councilman.
Okey doke. Thank you.
The other big one, to continue with the transportation items, straightening out Ironwood. The infamous S-curve is here. There were a lot of different ways looked at what could be done with it. Where it landed is looking at just simply trying to straighten out the S-curve a little bit and see how that looks. The other big key thing that emerged is there were really two areas that the public and the design team thought was a candidate for more development. The primary one is probably on the east side of 95 here. The area is pretty big and empty when you stop and look at it and think about it. The other area is, of course, around the Kootenai Health Core. More primarily, the area is back off to the west of that where you just see a lot of underutilized properties. And here is the draft final plan that we came up with. This is obviously still on trace paper from the design team doing their thing during the day the whole time. And you can see most of those major elements. You've got the overpass, you've got the right in, right outs. The other one we talked about, again, that I failed to mention was getting Ironwood connected out to where you can get to Forest, so you've got another route to the freeway. Yes, Councilman?
14 years ago, we tried to push Ironwood through with the church. I just revamped that story. And the church is expanding right now, and that spot is kind of gone, and they didn't want to give up there. So yeah. I love that everybody saw that, but I don't see how it's going to work if it's not included in the urban renewal district to where there's some economics to make it work.
So you brought up 2 points that I would like to address. The first, and maybe take a step back, is this is the results of a 3-day workshop. So now we're going into hitting the master planning hard, and we'll be back at the end of August. So there's lots of little details like what you just mentioned that need to be uncovered and thought through a little better. So we're in process of doing that. And that's a true statement for the whole master plan that you see here. For us, the real work begins now, although the charrette was no small lift. But now we're getting into the weeds and starting to find those details and work with whoever we need to work with to talk them through and get it narrowed down a little bit. There's still going to be some unknowns and some things that aren't fleshed out. Right now the talk is for a 20-year plan. It'll change. It'll evolve and change as it goes. And that's a good point. It's outside the renewal district. The question briefly came up, should it be changed or expanded? And the answer was no. If that's truly worth pursuing and it makes sense, then it's something that maybe the city would look at by funding by some other means. And of all the moves up here, provided the land's available, which is a really big if, it's probably the cheapest in terms of transportation moves, other than the effects on Third and Fourth and the need for signals there would probably change that equation pretty quick. When we straightened Ironwood out and looked at it, it's really only from here to here that you're talking new road, the rest of it's existing. There'd be a lot of work done to get that through there, but what it does is allows you to open up a street network that gets you a lot more connections in and out. That tied in with the overpass and the idea of continuing Kootenai Health's loop road that they've got that kind of dead ends out right here, and just wrap that all the way around so that there's another circulation route through the area, again, to take the traffic off of Ironwood. And again, it would naturally feed into the freeway overpass as well. This is 20-some feet up in there, and then the land falls this way, so you're talking about roadways that are elevated in the neighborhood of 30 feet through here, which turns into a fun thing to try and do, a welcome to Coeur d'Alene sign or some sort of other landmark. But, again, it's a very significant investment.
I'm going to hop ahead a little bit, but there's a reference on the last slide to a parking structure. Where's the parking structure?
It is right here. If I had PowerPoint skills that let me put a flashing red dot on it, I would have done it.
It's supposed to be
but yeah.
a P.
We've, the talk of a parking structure is here, just because the biggest need for the parking structure is flowing in and out of Kootenai Health. They have some very conceptual preliminary plans for additional expansion in this direction. And then when you get into more development potential through this area, it could also be there to serve that area.
Is there any plan for connectivity regarding non-personal cars? I mean, is there going to be any type of public transportation that's going to be available in here, like a shuttle for people to get around? Have they talked about that?
I don't think like a corridor-specific shuttle's been talked about, but we are working with the transit, their exact formal name escapes me, but the local transit agency to map their routes and then work with them on what they would like to see for their routes. They definitely have routes that are geared toward the hospital to help people who need services get in and out of there.
Okay.
And of course, they have, special needs on where they need picked up and dropped off as well. So they are definitely being included in the loop as well. The county's done a nice job of engaging on that front.
And that's one of the, when this area is growing, and it is growing, and there's more services necessary, and we heard from people earlier today who have trouble getting around. And so a lot of what my concern is for this is if you have this medical campus, this health corridor, then is there not part of the process thinking about how are we going to get people around? So they go to the parking garage or they find a place to park, but they need to go here and there. Just wanted to see if that was part of the big picture.
Yes, it certainly is. So there's that. The other two sides of that, although it doesn't directly address those needs, but the people who like to bike and walk, the discussion's always there to improve the trail network and improve the bikeability of it so people have another way than just going in their car. There were a few people tonight who spoke up along those lines. Probably the minority, in all fairness, but multimodal transportation is the planning term for it. So I would be looking at the bikes, looking at the pedestrian paths, which the thought on Ironwood through here would be to have good bike lanes on both sides of it. Obviously in the winter, it's also the snow storage area. And then there's a natural greenway here already that comes down through here essentially that would tie into the trail Kootenai Health already has built. So you'd have an outer walking loop. And then we're getting awful close. The Centennial Trail or spurs off of it at least exist right in this area. So we're getting awful close to being able to connect into the regional trails for people who are wanting to bike or whatnot. And then all the streets through here would be, set up for the on-street parking is where the discussion's at right now.
Well, let's make sure we do bike lanes, and I know you're probably talking to experts on that. There's different classes of bike lanes.
Right.
And the worst one is the white stripe that just goes right down the gutter. So I think our biking community would appreciate some nice class, whatever they are, the top class.
Certainly. I don't have the rendering with me today, but there was a rendering that was part of this and went with it that was a cycle track is what it's called. So it's got the wide separate bike lane that's got the two white lines that separate it from traffic.
Okay, good.
Any other questions on this one?
I do. I have one.
Yes.
Can you go back to that one where you're straightening out the curve? And I love that idea. I was kind of trying to look at all the buildings that will be changed. Are you being able to bypass that giant gym? So you don't
So
have to,
the
I'm looking at the
final
buildings
layout
that have to go
here-
away.
I gotta get my bearings for a second, bear with me. So, this particular rendering, you're right, the Peak Athletic Club would be right there. Not exactly ideal area for an athletic club, but it comes back to what I was telling you before. Now we're taking a deeper dive. We'll start looking for those little opportunities to do things like miss buildings or preserve existing streets and take advantage of what's already there.
So there's a little flex left until you can
Yes.
figure out the actual pathway.
Exactly.
Okay, thanks.
Yep, good question.
Any other questions for Ben at this time?
At the end.
I don't think I've got any more slides other than to tell you where we're at in the process. The blue box is us on the master planning effort. That's a view of the whole process. A little more than halfway through it, you'll see us back in August with, I believe, a 90% draft to talk more seriously about a lot of specifics on it.
Okay. Woody?
I have one more question. So this is all cool. I'm still not sure how it happens, how there's things already there and how does that go away and who pays for it and all that. My question is there a model for something like this? Is there a health corridor out there somewhere where they kind of created this thing that you guys are
Yeah.
trying to create?
So interestingly enough, I don't have specific knowledge of those myself, but the other people on the design team who do this for a living are aware of it. And health corridor is not a term that's unique to Coeur d'Alene. There's multiple pursuits of this across the country, really, with Mayo Clinic in Rochester being lifted up as the goal, or the big shiny hospital on the hill, if you will, and how it works and functions with the community. So we're not the only people who see this as a growing need and something that they want to use to continue to enhance their communities.
Okay, thanks.
Dan?
Thank you, Mr. Mayor. So, Ben, at what point are we going to get some financial information? Because you've got a plan that has a bridge in it, and you've got a plan that, I mean, if you're going to be straightening Ironwood, there's some property that's going to need to be purchased, some right away.
Yep.
So are we going to receive some financial projections for all this?
Yeah. So to fill you in a little bit more on that, the economic feasibility side's well underway. All the background existing is basically built. So the two paths are coming together. The economic feasibility and the concept now are coming together, and those need turn into a joint implementation plan. Because bringing you a plan that's not fundable is of no use. So building it together, and that process is happening, and that's part of the 90% draft I was talking about.
Okay, excellent. Thank you.
Any other questions? All right, thank you very much.
Okay.
Appreciate it.
Thanks.
Thank you.